Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. I'm here today again with Priscilla Hidalgo, who is a psychiatrist who specializes in helping women and helping people with stress in their lives and working through it. And today I just wanted to talk a little bit about mindset because I feel like I hear so much about mindset that, mindset is a big problem and limiting us. And if we change our mindset, then we can change our lives. But what does that really mean? I mean, we hear about mindset all the time. What is mindset?
Thank you for having me back. This is really fun to be again here. Mindset, the way that I like to think about it is that it's just basically our attitude towards things, towards our experience of the world, situations, and what's going on inside of us. And as you can imagine, it's a very broad definition. And I think that's where it comes in, what you were talking about it a few seconds ago, which like the different types of mindset, I'm sure you've heard like, oh, you have a growth mindset, a positive mindset. And sometimes it can feel confusing because I think that many times it is explained in a way that if you have one mindset, you cannot have the other one. And also it seems like a very abstract concept. So how do you even get a specific type of mindset?
Yeah, exactly. I mean, does changing your attitude or changing your mindset, can that really impact your life so dramatically?
I think so. I think so. One of the things that I ask my patients to do when we're working on reframing some of the way that we think about certain situations is to visualize what would it be like if it was different. So for instance, let's say we're talking about, I want to have a more growth mindset. I want to improve myself. I want to lose weight, whatever it is, what kind of insert in the blank space, what is it that you want to do, but visualize what would that make you feel like, not exactly what is it that you would be doing, but how would you feel? Because the feeling is something that can help you figure out your why and can help you figure out what are the changes that you need to make in your mindset. So for instance, if we were talking about that, if I were to feel more empowered, if I were to feel that I am able to grow, that I am able to learn new things, I'm probably going to feel more excited about learning new things, and I'm going to be taking steps to do that. Then if you start thinking about what would I do once I have that feeling, well, I may speak up more at work because now I have more knowledge about a certain situation. So that's going to make me feel more confident, and it's going to make me feel more empowered when it comes, like in this example in particular, with speaking out at work.
Okay. So you suggest focusing with the emotion and what that makes you feel like, that's the first thing rather than focusing on the action?
Yes, because I can say, we can, and you probably can relate to this in terms of, oh, you have so many continuing medical education credits that you need to get for your license,
Yes.
right? And they're like endless. So you can think about, oh, I want to learn about all these different things, but I also have all these different articles, all these different credits and conferences that I need to go to. But if you think about it from the standpoint, like, oh my gosh, I will get to learn something new, or look at this article on, let's say, optimism in the elderly population, now you're thinking about it more from a growth standpoint because you're thinking about what can I learn from it instead of just, this is just something I have to get done and be done with it. But don't get me wrong. I mean, there's some things in life where we just have to get it done. That as much as you want to change your mindset about, it's not necessarily something that will change, which is actually a good segue to like one of the myths about mindset, that if you have, a specific mindset that you're unstoppable and that anything is possible. We're not delusional here, so not everything is possible, and you won't be able to accomplish, perhaps everything that you want to do, but it can certainly help, get you on the right direction.
Yeah. Yeah. I mean, I feel like a lot of the articles that I read about mindset, it does seem like it has the promise of changing everything, right? And allowing you to do anything that you want to. And I hadn't taken it so far as to say, oh yeah, that sounds a little bit delusional, but it does sound far reaching, right?
Yes, yes. I mean, even if you think about it, mindset could also be, uh, not could also be, but I think let's think about a positive mindset. I think a lot of people think that if you have a positive mindset, that everything you look at the positive side of everything and everything is great. I personally don't think that is very realistic because life happens, right? So what a healthy mindset allows you to do is that it allows you to recognize that there are certain situations that are hard, that there are things that you are struggling with, but you can still acknowledge things that you can do to work with the situation and not just blindly thinking, oh, this is just great, I just lost my job, but it's okay, something better will come. Yes, that is probably true, but also acknowledging that this is really hard right now and that right now I have to find a job because I need to pay for things like electricity. So it may not
Right.
be my dream job that comes back next. It could be just something that pays the bills.
Do you think most people recognize their own mindset and kind of where they're starting? I mean, I feel like there are a lot of attitudes and beliefs that we all have that you haven't necessarily deconstructed, right? It's just kind of the way that you are.
I think so. I think that in order to, I think to be fully aware of the mindset, I think you have to work actively on it. I mean, let's take, if you grew up in a family where, the idea is that, let's say, when you failed a test in school, and then let's say your mom said, you know what, yeah, you didn't do great, but you know what, what this means that the next time you have to prepare better. And then next time you just do it. That is kind of teaching you to have a growth mindset where you can see where there's a setback and what you can do to look at the situation differently and improve it for the next time. So I think that that kind of thinking and behavior might be more unconscious. So because it happens as you are growing up, so you may not be fully aware. But there are certain things, especially in therapy, that I work with my patients that we identify some of these patterns in the way that we think about certain situations and how we react to situations, that we actively have to work on the mindset. And I think that's when people become even more aware of kind of how they think.
Yeah. What are the different types of mindsets?
There's so many out there, and I think that over the years more will continue to come out. I'm sure you've heard of the growth mindset, the
Mhm.
fixed mindset, a scarcity, abundance, positive, negative mindset. But like I said, I don't think it's one mindset over the other, but rather that the skills that you use to have with a particular mindset might come in handy in a situation, but then other skills from a different kind of mindset might actually come handy in another situation. So I
Yeah.
think most of us, I like to think of it more so like in a continuum, and then we kind of pick and choose depending on what we need.
So you don't necessarily think one mindset is better than another. It's more picking and choosing from the different mindsets.
Yeah. And of course, it depends on the situation, of course, that you're dealing with. But, for instance, I think one of the most common ones that we talk about is the growth and the fixed mindset. And with fixed mindset, there is the idea that you're not really interested in learning or improving yourself. And when something happens, you just say, you know what, it is what it is. And that's it. Whereas in a growth mindset, then you might think about, okay, well, perhaps I can prepare better for the next time, or maybe this is a different way where I can pivot and do something different, approach the situation differently. So there is kind of that element there, but there are some things that I think are fixed. If you have a situation in your life that is not something that depends on you to fix it, there's no, you can have all the growth mindset in the world, but if it's not in your power to change it or or do anything about it, you might not be able to change it. But where I can see having a little bit of a mindset kind of footing there is that at least you can start looking at the situation differently and say, you know what, there's really nothing I can do about this situation. and the situation sucks, whatever it is, the situation
Hmm.
sucks. But at least, having a positive mindset where you say, you know what, I cannot do this, but at least I have this, and that to face the
Yes.
situation, kind of makes things a little bit better.
I know, for me, I definitely believe in a growth mindset, but one of the things that has helped me at work, I think, is a fixed mindset in some ways, because I have this attitude where, I only try to change the things that I can change, right? And there are
Mhm.
certain things about medicine that I don't necessarily like that are just, part of the rules and how we interact with, let's say, insurance companies and, that type of thing, or maybe the EMR. And those are things that I just let go now because, it's just the way it is, right? And those things I can't change. And that has actually, allowed me to move on and not perseverate on these things that, do drive me bananas. But
You're absolutely right. I think I have a fixed mindset with certain things, when also, when we realize that there are certain things that we just are not able to do. Like I look at my calendar and I'm like, there's no way I can be here, I can be there, I can do this. And like I cannot be available all the time for everyone. And that is just the way it is. There's no positive mindset about it. There's no growth mindset about how can I rearrange my schedule. It's just like I'm human. There's only one of me. So there are certain things that I will be able to do and I won't be able to do. And
yep.
again, we can make the argument that's a fixed mindset, but in this case, and like what you were talking about, I think it is necessary
Yeah.
to be able to get things done.
Right. Rather than getting, angry or irritated every time, right? Just kind of saying, wow, that is a little frustrating. Okay, let's move on to the next thing.
Exactly.
What are your three, best tips, most practical tips to improve mindset?
One was a visualization that I was telling you about, just to kind of imagine how you would feel and how that would change your life. Like, what would you be doing differently if you felt this way? The other thing is to start to be okay with the fact that you're not going to make everyone happy. Because usually when we're working on our mindset, that also means that we have to set boundaries with other people. I'm sure you face people that, you say, hey, I'm thinking about doing this, or I'm thinking about exploring this. And their reaction is, it might be, oh, no, no, you cannot do that. There's no way you can do that. Life doesn't work out that way. So there are some people in your life that may become an obstacle to you changing your mindset. So we have to be okay with setting boundaries with those people and like being okay with the fact that they're not going to be happy with us, which is not easy.
Yeah, I was just going to say, I think that's really hard for most of us. I think
Yes.
especially for women, right? Like when I look at my husband, I'm always surprised at how those things don't bother him as much as they bother me, right? I'm much more of a pleaser. And he just kind of says, well, I don't really, that's okay. It's okay if someone doesn't like this. But I have this innate desire to please most people. And I think that so many women, right? I mean, I see this in my patients too. We want to make everybody happy.
Mm-hmm. Yes, and I think when you were talking about that, I was just thinking like even when you have like when you're hosting someone to come over for dinner, you want to make sure that they have a good time. And I think as humans, we have that innate desire to help other people and make
Yeah.
sure that other people are happy. But you're absolutely right that women are in an even tougher situation because we often take that role of making sure everybody's okay. And we're usually the ones that solve all the problems. So we want to make sure people are
Right.
taken care of. And sometimes when we say, you know what, I'm actually going to stop doing that because that is taking too much of my time, someone else might say, well, why are you doing that? Like that affects me. And that is not
Right.
always easy to kind of come to terms. And I think that's where, it also comes handy to, which would be a third tip, to surround yourself with people that have a similar mindset that can also help you. Because if you're the only one, that has a mindset where you want to grow and do things differently and you want to improve yourself, it's going to be very difficult for you to change your mindset when your environment is giving you different signals and different messages. So connecting with people that have a similar mindset or people that you look up to, that you think, you know what, this person seems like they have it figured out. Let me see what has worked for them. I
Yeah.
think that also can be helpful.
Well, and I think that's hard, right? Because a lot of your suggestions really involve prioritizing yourself, right? And
Mhm.
recognizing what you need and being comfortable with what you need and putting that first. And I think that too is a mindset and, difficult to do for a lot of people.
Yeah, even going to the doctor,
Yeah.
for women, we usually take everyone else to the doctor before we go ourselves. We might be noticing some symptoms. So we're like, that's nothing. That's nothing.
Yeah.
Until it's something really bad. They're like, okay, I really have to go to the doctor
Yeah.
now. And you're right. It's about changing that mindset where we say, you know what, in order for me to take care of other people, to be there for other people, I have to take care of myself.
Yeah.
And that also means being kind to yourself, that there will be times where you're like, you know what, I have this way of thinking about things and about responding to situations instead of reacting. That, I can do this, this is good. There will be times that you won't be able to do it. There will be times that you will be put in situations that you might say to yourself, I would have done this, or I would have thought about the situation differently, but in the moment that wasn't possible. So being kind to yourself, and being able to make changes within your possibility and within your environment
Yeah.
is very important, because you're absolutely right. I mean, all these things sound really nice, in theory, but it is honestly making like small changes on the day to day that,
Yeah.
making the decision that you're going to take care of yourself, and that, there's only one of me. As much as I want to go to this person's birthday party, I really need that time to be able to just rest and be at home.
Yeah.
That is a change in the mindset.
Well, and I think all of those things, require that you're present and that you're really thinking about things and you're quite deliberate in your responses and your actions. And all of that is easier. It's never easy, but easier, if I'm well rested and I've eaten well and, the kids are fine and everybody else is fine, right? When you're in your normal day to day, it's hard to be so very
Yeah.
present all the time.
Agreed. And even that becomes exhausting. I mean, there are times that you just kind of want to check out, just so that way you're not constantly dealing with the same reality
Right.
every single time. I mean, we all procrastinate every now and then. When you were talking about the dealing with insurances and let's say prior authorizations, you see that message there and you're like, I know I have to deal with that, but right
Right.
now I'm gonna have a cup of coffee because I need to be able to be okay in order to deal with that. Yeah,
Right.
you're absolutely right. I mean, we make those kinds of decisions every day.
I didn't even want to say that word, but you're right. I mean, that is one of those things that I've just had to totally let go, because it's just a reality of the system that we live in these days. So you started touching on this before. What are the myths about mindset?
Well, one is what we were talking about a little bit, that a growth mindset is the same as having a positive mindset. And, growth mindset just allows you to see the obstacles, see what the challenges are there, and what you can do to improve things. Is not just thinking about situations and things in a positive light, in disregarding everything else that may affect a situation. The other thing I often hear is people tell me I'm too old to change anything. This is the way that I am. This is how I think. It is what it is. And it's people are never really too old to change. In my opinion, if people did not have the ability to change, I wouldn't be able to help people,
Yeah.
because my as a psychiatrist, the work that I do with my patients, the basis of it is actually being able to change, and kind of the change the way that you think about certain situations and about yourself. The other thing I would say that is probably another mindset, another myth about mindset, is that you can just have one type of mindset. Like what we were talking about earlier, where a fixed mindset might come handy for some situations, whereas having an abundance mindset also comes handy for a different type of situation. Like I said, I think it's more of a continuum. So I think we kind of go back and forth between different types of mindsets depending on what we need.
I love what you just said. I mean, some of the words that I try to never say are at your age or, anything reflecting limitations with age. I mean, things do change, but it doesn't mean that it's an impossible situation, right? And
Right.
I think, it's easy to make that excuse, right? This is just the way that I am. But if there's something you don't like, you can always change that, right? And we see examples of that
Completely.
all the time.
True.
So do you think that you can change your mindset on your own, or do you think you always need guidance and help with it?
I think you can do it on your own depending on what is it that you are looking at. For instance, like your situation at work, let's say, and if there is something related to how you can better prepare for a presentation or how you can prepare a good report to show it to your boss. I mean, you know your own situation at work, so you know what needs to happen. So those things are things that probably you can do on your own. But even then, there are coaches everywhere that will coach you on your business, on your life, will coach you on your performance at work. So all that stuff, it's also it's not necessarily on your own, but you have other people to support you. I think the part where it's something like therapy can become really important as you are working on the mindset is that there are thoughts that are giving us distorted signals or distorted messages about reality. So for instance, let's say I text you, but you don't text me back. And then I automatically think that that you don't care about me, that you're no longer my friend. Then we have to work on kind of changing that because that is not necessarily rooted in reality. It could be that you're just really busy. You couldn't get back to me until the end of the day. And that's where I think that the therapy kind of comes in with changing the mindset where we start looking at those thoughts that are not really helping us, that just kind of makes us feel bad, gets us stuck, and then figuring out ways to challenge those thoughts. And then that will help you change your mindset because now you're looking at a situation differently. And therefore, you're going to respond differently to the situation. You're going to feel differently.
Yeah. And I think, sometimes identifying, what you're doing and those thoughts that are driving things can be really difficult, right? And having someone to kind of guide you through that or, maybe challenge you a little bit on some of your thinking.
Yeah, I ask patients to keep a journal of thoughts actually. And I one of the ways that I help them figure out like what are the thoughts that we really need to look at is whenever there is a change in the way that you're feeling. So if you're feeling fine and then something happens in your, let's say at that moment you're feeling kind of sad, overwhelmed, whatever it is, let's look at that situation that happened in that moment and let's pay attention to those thoughts that you had at that moment to try to figure out why did you feel that way? What kind of went through your mind? And that is an exercise that takes time because thoughts sometimes happen so quickly that we are not especially, let's say, aware of the specific thought that went through our mind that made us feel in a specific way. But when you start paying attention to the changes in the way that you feel in your thoughts, then you can start tackling those thoughts and challenging them. So that way you can really compare them to the reality of things and then say, okay, well, that is not particularly true, or that may not be true. So maybe I'm jumping the gun and feeling that people don't like me.
Right. Right. I mean, it is interesting how frequently it comes down to, very negative thoughts that we're having about ourselves, right? I'm not worthy. I'm not good enough. I could never do this, right? People don't like me. All of those things, which, are usually not true. We're
Yeah.
kind of our own worst critic and jump to I'm just so bad at this.
Yeah. And honestly, I know this is going to sound bad perhaps, but people are so busy with their own lives
Yeah.
that I don't think they're paying so much attention to us and then thinking, oh, I don't like this person, or I don't think this person is good enough. If anything, most of the time, if you really hear what other people talk about other people, they actually admire the other person. Or they're saying, oh my gosh, this other person is doing all these different things, and I'm not doing these different things. So
Right.
I think it's a skewed reality. And that's where, tracking kind of how you're thinking about certain situations can be very helpful.
Yeah. Yeah. I love that. Do you have any other pieces of advice? Anything else you would say about mindset?
Well, like I said, the biggest one I would say just to be kind to yourself, because like we were talking about earlier, it's not very easy to change your mindset. It's easier to visualize how you would like to feel and what is it that you would do once you have that feeling. That is usually easier to do. Is that gap between when you're working on changing your mindset and your mindset now is set up and it becomes a second nature, that becomes hard. So there will be times that you will be able to get it and you'll feel very proud of yourself. And there will be other times that you're like, you know what? This just didn't quite work out the way that I wanted to. So now I have to think about a different way of doing this thing, and try to separate this from your worth, because it has nothing to do, these are just thoughts, these are just emotions, it's just information, is not a reflection of who you are as a person. And I think that that's when, we kind of run into trouble, when we start thinking about all these things happen and then that is a reflection of who I am. And that is not necessarily true.
Mm-hmm. Yeah. Yeah, it's funny how sometimes we're our best friends, right? And sometimes we're our own worst enemies, right? And,
Yes.
can drive an awful lot of negative feelings and thoughts. And then that makes everything just a little bit harder, right?
Yes.
Um, Especially, for me, when we're trying to get patients to make behavioral changes and, do different things to help whatever medical problem they're having, right? So much in medicine is really about, diet and exercise. And I think mindset really impacts how well we can do those things.
Yeah, and also your physical health and your mental health. If you're having issues with depression, it's going to be very difficult to change your mindset just because of the illness of depression. Depression will actually make you focus on the things that are negative or the things that are really bad. And as much as you want to try really hard to change your mindset, if you don't treat the depression,
Right.
you're not going to be able to accomplish it. And I think that a lot of times people feel bad with themselves because, like, I cannot do this. I cannot do my diabetes medications. I cannot eat right and all the stuff. But they don't necessarily pay attention to all these other variables that, something as simple as, well, my medication regimen is so complicated that I have to take this medication so many different times during the day that I cannot keep up. So that makes me not do well with my treatment. Therefore, physically and medically, I'm not doing well. And it's not necessarily an issue with mindset. That could be that perhaps we just need to change the way that your treatment regimen is. So it's just so many different variables to consider.
Yeah. Yeah. And I think it is important to remember that, for some people, changing mindset is straightforward. And then for other people, there are a lot of other things that need to be addressed at the same time.
Yes, like I said, when you were talking about, taking care of everyone else and how your husband is much more, it is what it is, people will figure it out kind of attitude. I just remember how I actually wrote down in a piece of paper, I cannot do it all.
Yeah.
Because I remember I was like, I cannot do it all. I cannot just like host a wonderful party and then also be present to manage social media or also
Right.
do this. It's just too many things.
Yeah. Yeah. And I think we do try to do it all, right? And recognizing your limitations and setting boundaries becomes really important. But, that's not necessarily our culture or how many of us are kind of built, right? I think, this is a little bit of an aside. I think social media makes all of those things worse because you see so many people and it looks like they're doing it effortlessly, but you're just seeing, what they're presenting to you, right? Not actually the details of what that looks like.
Yeah. And you're comparing their best picture, let's say on
Right.
Instagram, with how you're feeling in the moment.
Right.
So it's just so separated. It's not even a fair comparison. Like you're not even saying, let's take the same picture on the beach at the same time of the day, wearing the same clothes. And even that is not necessarily a fair comparison because you're talking about two different bodies.
Right.
But it's hard to see.
It's hard to see. And it always makes me laugh because sometimes my favorite pictures, the pictures that just look the best of my family, do not reflect the chaos that was actually going on in that moment and what it took to get everybody in the right place and smiling and blah, blah, blah. And it is just this 1 second in time, but the actual moment was fairly crazy, right? And so I always have to remind myself that.
Yeah.
And it just makes me laugh, right?
And sometimes the best pictures are the ones that kind of happen in the chaos of something. And then you see people like really laughing and enjoying the moment.
Right. And everyone's personality is reflected, right? But it's not always the picture that I dreamed of, right?
Exactly. And
So,
that's a really good thing. What you just said now, I really like that. It's not the picture that I had in my mind, because I think, I'm not saying that we shouldn't have expectations, but I think sometimes we get so attached to these expectations that it makes us feel bad. And I loved how you said, oh yeah, you see the picture, but then you don't see the chaos that is behind it. And and some people might say, oh, she took the perfect picture, her house is perfect, kids are perfect, everything is perfect. And yet you're thinking about that is such a different type of expectation that I have.
Right.
I'm
That
just happy
I
that we got the
actually
picture done.
just kicked the clutter out of the picture, right? And if you could see just a little bit further, you would see where
Exactly.
it all is. So
Yeah, I love that.
yeah, I think that's true for most of us. Well, thank you so much for your time and your expertise. I think this is so helpful for so many people, and I think mindset is really important, especially in our chaotic world, where there are so many things to kind of worry about.
Thank you so much for having me again. I really enjoyed talking to you. Your podcast is so helpful in so many different ways, and I love how you address all these different issues that honestly we are all thinking about,
Yeah.
but we don't really talk about them that much.
No, we don't, right? And yeah, I mean, I'm just hoping to educate women, right? And to provide a little help out there and make things a little bit easier. So thank you for
Yeah.
enabling that.
Thank you for having me.
Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.